Hello everybody, I am Dr. Shalin Shah. I am going to perform phacoemulsification of NS2 cataract. I am operating the left eye. I am going to perform phacoscleral emulsification. So I am going to first take the superior rectus bridal suture to stabilize the eyeball. Next I am going to make a 10 to 2 o'clock peritomy with cauterization of conjunctival vessels by ballpoint cautery. Then I am going to make a side port at 10 o'clock by MBR blade. I am injecting the trypan blue dye to stain the entire capsule for better visibility. Then I am increasing the magnification and inserting the cystitome and put a nick from center to the periphery and raise the flap. So I have done the around 5 mm continuous curvilinear capsular axis by 26 gauge cystitome. If you are not visualize the flap, better put a visco on the cornea so it get magnify, and increase your magnification and stabilize the flap by putting visco onto it. Always stabilize your globe by Hodgkin's forceps at 3 o'clock so you can make a round curvilinear capsular axis, so phaco emulsification will be easier. It's mandatory to have a very good CCC for the phaco emulsification. Then I am putting the scleral incision at posterior limbal 5.2 mm in size, and I am going to make a tunnel with 2.6 crescent blade Always remember, make a tunnel not only on sclera but both in sclera and cornea. Always check your tunnel adequacy. Then I'm going into the eye by 2.8 blade. And I'm going to make an entry wound. Now my next step is have a good hydrodissection and hydrodelineation for the good rotation of the eyeball. So I am putting the visco inside the eye. So with the help of cannula at the 7 o'clock and 4 o'clock, I'm injecting the BSS, but the fluid wave is not complete, so I again inject and tap the nucleus to prevent the capsular blowout syndrome. Always tap the nucleus while doing the hydro. And I am trying to rotate the nucleus, but it's difficult to rotate, so don't attempt in much. Do another hydrodissection, otherwise it will the grave complication in zonular dialysis. So good hydrodissection is the must, and the good CCC is the must for the phacoemulsification for the beginners. Now nucleus is rotating very smoothly in the capsular bag, so we can do the trenching. I am going to use Opticon phacoemulsification machine. Before inserting the phaco, you have to check the sleeves and parameters and put the left side port for the chopper maneuver. My guru Dr. Parth always says first insert the chopper for the stabilization of the eyeball and then insert your phaco probe so eyeball doesn't move downwards, so you can have a very good visibility of the lens capsule and the phaco machine. While inserting in the scleral wound, you have to insert in the rotating fashion. Stabilize your eyeball with the chopper. First do the vacuum, so remove the superficial cortical matter, and I am going to do the divide and conquer technique. I am doing first trenching. I make a central trench. This is adequate trench. The adequacy decided by the glow at the bottom part of the trench, so you can divide the nucleus in the two halves. Your left hand chopper will guide the nucleus rotation and help in the cracking the nucleus. I am cracking the nucleus in the two halves. It is important to have a complete division of the nucleus before you switch to the phaco 2 mode. Then I am rotating my nucleus and do another trench in the another hemi half and divide the nucleus into another two halves. I bury the phacoprobe, and from backward the chopper move from periphery to the center and it divide the nucleus into two halves. This is the last piece of the nucleus. Now I am going to take the one piece and I am switching to the phaco 2 mode. Before switching to the phaco 2 mode, you have to check whether your piece is completely separated from the adjacent piece, so you have no difficulty in emulsification of that piece. Always emulsify the nucleus in the pupillary plane. Don't do in the anterior chamber, it will hamper the endothelium function. Always make sure your phacoprobe tip is in the center 3 mm optical zone, so the fluidics is maintained in the anterior chamber properly. Now I'm going to take the second piece and divide into two halves. Now with the help of the dialer, I rotate the piece opposite to the phacoprobe so I can grasp it easily. Always remember the occludability is the important factor. If the phaco piece is occlude, then you have to apply the power and you have to switch to the pedal number 3. Just occlude, and when it get occlude, apply the power and switch from 2 to 1, 2 to 3. Always be careful for the emulsification of the last piece of the nuclear fragment. The surge may sometime the PC rent, so always be careful and always be cautious in emulsifying this last nucleus fragment. So the last piece is easily emulsified and taken out. Try to avoid phaco 3 mode for the epinucleus management for the beginners. I am doing the IA bimanual irrigation aspiration mode. One small nucleus piece is hampering the IA, so I remove by the main incision. Always remember, by doing the bimanual for the beginners, always insert first the irrigation port, and it is only used for the stabilization of the eyeball and for the chamber stability. Only move your aspiration port. I am going to insert 5 mm optic PMMA eyeball, so I am enlarging the wound. This is 5.2 crescent, and enlarging the wound, and I am inserting the PMMA eyeball, the PMMA lens. Thank you for watching. This is Shalin Shah.